that if PICC lines work properly, patients will experience less discomfort from medication administration, blood infusions, or even blood draws. This will turn a rather uncomfortable experience into a manageable experience for the patient. Again, if this is to occur, proper training is vital. The management and staff attended an in-service training conducted by our hospital PICC line nurse on the proper way to clean and change dressings and what to look for as far as insertion length and numbers. We were also shown what to look for in case the line has been pulled out. Also, there were teaching of proper technique to remove the PICC line and what to look for. The training ended with all staff being educated on how to make sure all PICC and port ends are closed to air, which was our specific issue and primary cause of the in-service training. There are different hubs or adapters to use on the ends of the lumens to close them off to air. Our mission then was to educate the nurses and aides working closely with the patients with PICC lines. When trying to figure out how we could spread the word and educate the nurses on our units about the proper PICC line care and leaving the lumens open to air, I suggested passing the information off to the working nurses and aides in our huddle board meetings that are done at the beginning of every shift to make sure we connect with everyone that could come in contact with PICC line patients. Another option I suggested was, when passing the information along in report at shift change, was to also have both the nurses check the lumens together and document that they are closed to air. I wanted to also add this task to a to-do or checklist, so when making room rounds that they could be personally checked by the charge nurse. I was involved in the competency training classes that were organized and included the PICC line cleanings and removals. Education was provided on looking for those closed lumens and what to do if one was found that was not closed. All nurses and aides had to attend these competency training classes, and verification that they did attend and participate was provided. Those that could not attend during the day were given a special training held later that night to make sure we caught everyone, even those on night shift. In the huddle board meetings, I reiterated all PICC and port information learned in the competency training class and continually reminded staff to check for the open lumens during their roundings. I asked that both nurses check those lumens during their handoff report. If any were found open, they were asked to report those back to the charge nurse immediately. Once all staff was trained to proper care and maintenance of PICC lines, it was the task of the RNs to administer patient training. Each patient with a PICC line was informed of what to look for to make sure that their assigned RN was doing proper care and maintenance of the PICC line and how adverse conditions could look and feel. Once training of staff and patient was completed, we could assume that patients will verify that PICC line care has improved after training. In offering this hypothesis, some questions arise. Would the results be the same after 6 months? Would the results be the same after a year? How sustainable is the training? This in turn would suggest another hypothesis. If the results are not the same after a certain time interval, training would need to include a refresher session at particular intervals. In creating the study, I feel that PICC line care and maintenance fits into the descriptive research design combined with single study subjects. The PICC line patient group would be small in nature and easily identifiable to produce an effective and accurate outcome of research. Most researchers are looking for a design that is simple and cost-effective to launch, which engulfs the two designs that I mentioned above. In an attempt to eliminate error in the study, adequate training of the nurses is vital. PICC lines are not complicated, but in my facility, the abundance of new nurses makes the situation more of a safety issue. Interviewing nurses could easily identify the breakdown in communication and procedure of the care of the PICC line. The patient's knowledge of the PICC line in connection to the knowledge the patient holds about his illness and the road to recovery can easily be assessed as well. When the research study is initiated, the patient will then be fully aware of health goals and perception of PICC line care. This descriptive design collaborates well with the single study design group. Since the research group could be small in nature, the single study design group would be the perfect combination for the PICC line research. The statistics for this type of study can be used to anticipate the outcome of generalized findings for a single individual or case, which is a better fit for the PICC line group. The data for this group is collected and intervention is applied, and the responses of the individual are tracked over time. Educating the nurse and the patient will improve the probability of producing reliable data. Another design that I thought about is the survey design with the PICC line research. The research information could be obtained directly from the PICC line patients as a group. One of the key aspects of the survey is making sure the patient is fully educated on their illness, the hospital procedures, and nursing care. Sometimes nurses lack in the area of educating their patients. This makes the survey method outcome non-reliable due to the lack of patient knowledge on his illness and procedures involved. Population for the initial study will consist of patients who presently have or have had PICC lines inserted at our facility over the past 6 months. A survey will be used to determine how effective these patients felt their care was regarding the PICC lines and how informed they were to be able to identify weak areas of the care. A range of 1 to 5 will be used, with 1 being very inadequate and 5 being excellent. Once the survey results are tallied, weak areas will be identified, and if 25% or higher of the respondents gave negative replies, they will be given follow-up phone calls. It is important to determine the reliability of their responses. Is that negative response prompted by some other agenda? Maybe the patient didn't care for the hospital in general or the particular RN, or maybe this patient was just a naysayer. 75% or higher positive results will suggest success in the training. If that is the case, no additional training will be given for a year. After that training, a different population of PICC line patients that fall within that timeline will be given the survey. Follow-up refresher training will be given as needed. If, however, the percentage of positive responses is less than 75%, a more intensified training of the staff and patients will be given based on the survey results. 6 months later, the survey will be re-administered, especially targeting the weak areas. Results will determine the interval of time until the next training. When doing the research, the 2 standard ways of gathering and interpreting information are qualitative and quantitative approaches. The qualitative method investigates the research from a closer perspective using individualized interviews or focus groups to obtain the meaning of a phenomenon, event, or experience for that individual or focus group. The quantitative approach is used for a larger group of individuals and uses mainly survey methods, which may be too broad for my particular project, but can still be used, just making the group smaller. After reviewing the article, The Chronicle of Evidence-Based Mentoring, What's the Difference Between Qualitative and Quantitative Approaches? I have determined that my project can be measured more accurately by using the quantitative approach. This approach could entail the different complications and measure the percentage of the patients that were inpatient, outpatient, or that were inpatient and then went outpatient treatment with the same PICC line access. It could measure all possible complications that actually occurred with all these patients. This could also take into consideration the number of days the patient had the functioning PICC line. Asking open-ended questions during interviews with patients that have or have had a PICC line that needed to be maintained and cared for by medical professions is one aspect used for the quantitative method. By using open-ended questions in that individual encounter, the interviewer can gather more personalized information from the individualized stories of each patient, which may be used to draw the picture needed for the statistical conclusion. This information can be used to measure the effectiveness of interventions and then reported using numbers. The open-ended questions would be used in the follow-up phone calls to those patients who gave negative responses in the initial survey. There are several strategies that can be used in obtaining information for a research study project. In the article, What's the Difference Between Qualitative and Quantitative Research? Qualitative research is defined as being a method used to gain an understanding of underlying reasons, opinions, and motivations. The qualitative method doesn't have the same conclusion that the quantitative approach has, which I would think would be a better fit for my project. Quantitative research is defined as being used to quantify the problem by way of generating numerical data or data that can be transformed into usable statistics. The PICC line patients would be a small group that needs to be a one-on-one interview process, but also needs the number of statistics instead of just a developed hypothesis that the qualitative approach has. Possibly combining the 2 methods is the way to go for my research. The initial survey follow-up calls would use the quantitative approach. The main purpose of the study is to determine whether adequate training has been provided to both the staff and the patient to ensure safe care and maintenance of PICC lines. Has the training been intensive enough? Will it be sustainable over time or require refresher sessions? These are questions that the survey would address, allowing us to adjust our protocol for training. Using the survey as a quantitative approach allows for the collection of usable data to prove the hypothesis that proper training does improve PICC line care and management. In addition, follow-up phone calls during which patients with negative responses on the survey are interviewed to gather more specific data would be valuable in two ways. First of all, the interviews will target weak areas that will be used by adjusting future training, and the interviews will help determine the validity of the original negative responses. Rather than just giving training and forgetting about it, not testing its effectiveness appears to be the norm of today's society. However, if the end result is to go beyond the training itself to ensure effective results in patient care, follow-up inquiry to correct ineffectiveness is very important. This research study would make that a positive impact.